There is a lot going on right now in terms of the health insurance marketplace. We're seeing some of the larger payers introducing plans that reward the consumers for choosing high-efficient, high-quality healthcare institutions and clinicians by lower premiums or by lower co-payments. You're seeing a lot of innovation being attempted in terms of patient-centered medical homes, accountable care organizations without all of the constraints that the federal government has imposed on their ACOs. You are generally seeing attempts to try to figure out ways to slow spending and to improve quality. Now, we've been there before, so people sometimes get a little too excited too quickly as to whether the marketplace is really being transformed. We're relatively early in the process, a lot of promising change going on, but it will take a few years to see how much of what we see is sustainable, and sustainable in ways that the users will accept. One of the lessons we learned from the 1990s is that even successful outcomes, by which I might categorize the private sector initiatives of the 1990s, where we saw private sector spending in healthcare grow at less than the rate of inflation, something totally unheard of before that, produced a managed care backlash. Because for many consumers, they hadn't bought into this notion. Nobody asked them whether or not they wanted to be in a very different kind of healthcare plan that changed the rules in terms of seeing specialists or accessing medical technology. So hopefully we've learned from some of our stumbles in the past, recognize that it's not just producing desirable results, but producing desirable results in ways that clinicians and institutions will accept, but equally important that the American public, the user of healthcare services, will also accept. Without that, a lot of the promise and innovation that we're seeing right now will come to naught, but hopefully we're smarter this time around.